This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Sarabjit Kaur. With me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi interacts with political party leaders, says priority is to save each and every life. US President Donald Trump thanks Prime Minister Narendra Modi for allowing export of hydroxychloroquine, says India's gesture will not be forgotten. First installment of relief package to 20 crore women Jan Dhan account holders released. Supreme Court directs COVID-19 tests in approved labs to be conducted free of cost. And 20 COVID-19 hotspots sealed in Delhi to tackle the spread of virus. Uttar Pradesh government also seals hotspots in 15 districts. Prime Minister Narendra Modi has described the ongoing situation arising out of COVID-19 outbreak as a social emergency. Prime Minister asserted that the priority of his government is to save each and every life. He said the country has been forced to take tough decisions and must continue to remain vigilant. Interacting with leaders of political parties in Parliament through video conferencing yesterday, he said that several state governments, district administrations and experts have asked for extension of the lockdown to contain the spread of the virus. He noted that in these changing circumstances, the country should simultaneously try to bring about a change in its work culture and working style. The Prime Minister said the country is facing serious economic challenges as a result of COVID-19 and the government is committed to overcome it. Saying that the entire world is currently facing the grave challenge of COVID-19, Prime Minister praised the efforts of the state governments working together with the centre in this fight against the pandemic. He added that the country has witnessed constructive and positive politics through the coming together of all sections of polity to present a united front in this battle. The Prime Minister also praised the sense of belonging, discipline, dedication and commitment with which each and every citizen is contributing in this endeavour, be it in following social distancing, Janta curfew or the lockdown. Prime Minister further said, India has been among the few nations which controlled the pace of spread of the virus till now. He also cautioned that the situation keeps changing continuously and one needs to maintain vigil at all times. Our correspondent reports that leaders of different political parties provided feedback, suggested policy measures and discussed the way forward.
The leaders appreciated the Prime Minister for timely measures taken by him, boosting the health and morale of the healthcare workers, ramping up testing facilities, the need to assist smaller states and union territories, and tackling the challenges of hunger and malnutrition were discussed. They also spoke about economic and other policy measures to boost the country's capability in this battle. Suggestions were also given by the leaders on extending the lockdown and on a phased exit after lockdown ends. Saubhagyakar, Air News, Delhi.
Congress leader Ghulam Nabi Azad, Shiv Sena leader Sanjay Raut, DMK leader T.R. Balu, Sharad Pawar from NCP, Rajiv Ranjan Singh of JDU, Lok Janshakti Party's Chirag Paswan, Professor Ram Gopal Yadav of Samajwadi Party, BSP's Satish Chandra Mishra were among those who participated in the interaction. Prime Minister Modi will interact with Chief Ministers of all the states on Saturday on the situation. Earlier, Prime Minister had 2 interactions with Chief Ministers over the issue. Government has completed transfer of first installment of 500 rupees to around 20 crore women Jan Dhan account holders as part of relief package. It was announced by the government last month in the wake of COVID-19 outbreak. Official sources said the money has reached each and every account and the beneficiary can withdraw as per their needs, keeping social distancing norm in the mind. Last month, Finance Minister Nirmala Sitharaman had announced that around 20.5 crore women Jan Dhan account holders will get 500 rupees per month for next 3 months to run their households.
Finance Ministry has imposed spending restrictions on various ministries and departments in view of revenue constraints caused by the COVID-19 crisis. Few ministries and departments like Health and Family Welfare, Pharma, Food and Public Distribution, Civil Aviation and Ayush will get funds as per the budget, while others like Fertilizer, Post, Road Transport, Petroleum, Commerce and Coal will face spending cuts. An office memorandum issued by the Finance Ministry has said that the existing guidelines for expenditure control have been reviewed. Keeping in view the present situation arising out of COVID-19 and the consequential lockdown, it is expected that the cash position of the government may be stressed in the first quarter of 2020-21. Government has allowed non-government organizations to buy food grains directly from Food Corporation of India, FCI. Consumer Affairs Ministry said that NGOs and charitable organizations are playing important role in providing cooked food to thousands of poor and needy people during the nationwide lockdown. It said to ensure uninterrupted supply of food grains to these organizations, FCI has been directed to provide wheat and rice to them at the Open Market Sales Scheme, OMSS, rates without going through the e-auction process. Our correspondent has the details.
Earlier, only state governments and registered bulk users like roller flour mills are allowed to buy stock from FCI under OMSS rates. These organizations can purchase 1 to 10 metric tons at a time from FCI at the predetermined reserve prices. FCI, which has a network of more than 2,000 godowns in the country, will ensure a smooth supply of food grains to these organizations in this hour of crisis. It will help relief camps in their work of feeding poor and migrant workers in the country. The details of lifting of food grain by such institutions will be intimated to the concerned district magistrates to ensure that the food grains are utilized for the intended purpose. Anand Kumar, AIR News, Delhi.
Government has issued an advisory to address the social stigma associated with the COVID-19 pandemic. The government has urged people not to label any community or area for the spread of the coronavirus. In its advisory, the Health Ministry said public health emergencies during an outbreak of communicable diseases may cause fear and anxiety leading to prejudices against people and communities, social isolation and stigma. It added that such behavior may culminate into increased hostility, chaos and unnecessary social disruptions. The advisory comes following a spurt in coronavirus cases after a Tablighi Jamaat meet at Nizamuddin in New Delhi. There are instances of people, especially on social media, blaming a particular community for the spread of COVID-19. The ministry also listed various do's and don'ts in the wake of the coronavirus outbreak. They include not target healthcare and sanitary workers or police as they are here to help people. The advisory came amid cases of harassment and social stigmatization of healthcare and sanitation workers. The total number of COVID-19 cases in the country rose to 5,274 today, registering an increase of 485 cases in the last 24 hours. So far, 411 people have recovered and been discharged from hospitals, while 149 have lost their lives in the country due to COVID-19. Briefing reporters in New Delhi yesterday, Joint Secretary in the Health Ministry, Love Agarwal, said, as the number of COVID-19 cases are rising in the country, the government's response and preparedness are intensifying accordingly.
The Supreme Court has directed that COVID-19 tests in approved government labs or private laboratories should be conducted free of cost. It has asked the centre that it should immediately issue directions in this regard. The top court said the private hospitals, including laboratories, have an important role to play in containing the scale of the pandemic by extending philanthropic services in the hour of national crisis. A bench of Justices Ashok Bhushan and S. Ravindra Bhatt, while hearing the matter via video conferencing, said that tests relating to COVID-19 must be carried out in the National Accreditation Board for Testing and Calibration Laboratories, accredited labs, or any agencies approved by WHO or ICMR. The bench said it is issuing the interim directions to the respondents that the tests relating to COVID-19, whether in approved government laboratories or approved private laboratories, shall be free of cost. The bench in its order said no person be deprived to undergo the COVID-19 test due to non-payment of capped amount of 4,500 rupees. It noted the centre's submission that government laboratories are conducting the COVID tests free of cost. US President Donald Trump today thanked India for Prime Minister Narendra Modi's decision to allow the export of anti-malaria drug hydroxychloroquine to the United States. He tweeted that India's gesture would not be forgotten and said that Prime Minister Modi's leadership was helping not only India but humanity as well. President Trump also added that extraordinary times call for global cooperation in the fight against COVID-19. Hydroxychloroquine has been identified by the US Food and Drug Administration as a possible line of treatment for the COVID-19. The disease has inflicted more than 4 lakh Americans, claiming lives of over 13,000. President Trump had requested the Prime Minister to lift the ban on export of hydroxychloroquine from India and supply the drug to the United States. President of Brazil, Bolsonaro, in his address to the nation today, thanked Prime Minister Narendra Modi and the people of India for helping Brazil tackle the COVID-19 outbreak by providing raw materials for hydroxychloroquine production. Mr. Bolsonaro said that Brazil would receive the raw materials following his direct conversation with Prime Minister Modi. He expressed gratitude towards the Prime Minister and the people of India.
A video conference of senior trade officials of all SAARC countries was held yesterday to discuss the impact of travel restrictions and the larger COVID-19 situation on intra-regional trade. This was a follow-up action of the announcement made by Prime Minister Narendra Modi at the video conference of SAARC leaders on 15th of March. External Affairs Ministry said in a release that all SAARC countries, except Pakistan, participated in the video conference. All countries contributed actively to the discussions on a wide-range trade-related agenda. It was recognized that the COVID-19 pandemic is likely to have a considerable adverse impact on trade in the SAARC region. It was stressed that new ways and means be jointly identified to sustain and expand the intra-regional trade until normal trade channels are fully restored. Minister of State for Personnel, Public Grievances and Pensions, Dr. Jitendra Singh today handed over a consignment of 2,200 essential kits for distribution to needy families in Delhi in the wake of COVID-19. Each such kit, consisting of 9 items, is meant to assist one needy family for some time. The items include 3 kg rice and wheat flour, 1 kg pulses, 1 litre cooking oil, 500 grams chivda, 1 kg salt, 1 bathing and detergent soap, and 3 packet biscuits. Kendriya Bhandar, which functions under the Department of Personnel and Training, has taken the unique initiative of providing essential kits to needy families. Dr. Singh handed over 1,700 kits to SDM, Civil Lines, Central Delhi District, and the remaining 500 kits will be given to District Magistrate, Central Delhi.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Sanjay Pandey of GB Pant Hospital, New Delhi, stressed on the need for maintaining social distancing, saying initial symptoms of common flu and COVID-19 are same.
इसके लक्षण जो फ्लू है या सर्दी जुकाम है उससे मिलते जुलते होते हैं। 80 से 85% जो मरीज होते हैं उनमें लक्षण बिल्कुल सामान्य होता है और वो रिकवर हो जाते हैं। 10% ऐसे पेशेंट होते हैं जिनको थोड़ी सांस की दिक्कत होती है, बट ऑक्सीजन और मामूली से सपोर्ट से उसमें काफी पेशेंट बाहर आ जाते हैं। 5 से 10% पेशेंट ऐसे हो सकते हैं जिनमें सांस की दिक्कत ज्यादा हो सकती है और यह तकलीफ आमतौर पर उन मरीजों को होती है जिनको पहले से कुछ हाइपरटेंशन है, डायबिटीज है, सांस की दिक्कत है या उनकी एज ज्यादा है। तो अगर कोई रिस्क फैक्टर आपके साथ है तो उस कंडीशन में आपको ज्यादा सावधानी बरतनी है।
Dr. Naresh Gupta of Lok Nayak Jayaprakash Narayan Hospital said there is no proven medicine to prevent coronavirus infection.
As far as we know, there are no medicines of proven value to prevent COVID-19. But there are some medicines which tend to be given on an empirical basis to the healthcare providers because they expose to a whole lot of onslaught of the coronavirus through the COVID-19 patients that they treat. As for the vitamin C or lemon, one can take it. It has been taken for preventing cold for hundreds of years. But there is no scientific evidence that vitamin C causes any prevention of common cold or of coronavirus also.
This is All India Radio giving you a special program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi interacts with political party leaders, says priority is to save each and every life. US President Donald Trump thanks Prime Minister Narendra Modi for allowing export of hydroxychloroquine, says India's gesture will not be forgotten. First installment of relief package to 20 crore women Jan Dhan account holders released. Supreme Court directs COVID-19 tests in approved labs to be conducted free of cost. And 20 COVID-19 hotspots sealed in Delhi to tackle the spread of virus. Uttar Pradesh government also seals hotspots in 15 districts. For quick news updates, round the clock, follow us on our Twitter handle @AIR News Alerts.
गांवों के सरपंचों के लिए कोरोना वायरस कोविड-19 से जुड़ी एक आवश्यक सूचना। दूसरे राज्यों और शहरों से वापस आए लोगों को कोविड-19 के बारे में ये जानकारी अवश्य दें। आपस में 1 मीटर की दूरी बनाए रखें। नाक, मुंह या आंखें अनावश्यक न छुएं। बार बार हाथ साबुन से अच्छी तरह 20 सेकंड तक धोएं। खांसते एवं छींकते समय रुमाल या कोहनी से नाक मुंह ढकें। कोविड-19 से बचाव के लिए आशा कर्मियों से सलाह लें। अधिक जानकारी के लिए अपने जिला मजिस्ट्रेट या मुख्य जिला चिकित्सा अधिकारी से संपर्क करें या भारत सरकार के हेल्पलाइन नंबर 1075 पर कॉल करें।
Delhi government has sealed 20 COVID-19 hotspots in the national capital to combat the spread of the novel coronavirus. Talking to reporters after a high-level meeting yesterday, Delhi Deputy Chief Minister Manish Sisodia said nobody will be allowed to enter or exit from these areas. He said the city government will ensure delivery of essential items in the sealed areas. Mr. Sisodia added that some positive cases have also been reported in Sadar area in the city and the area has been sealed. Delhi government has also made it compulsory for people to wear face masks when stepping outdoors to combat the coronavirus spread. In a tweet, Chief Minister Arvind Kejriwal said wearing of facial masks can reduce the spread of coronavirus substantially. He said cloth mask will also be eligible. Mr. Kejriwal also said Delhi government departments have been asked to stop all expenditures except salary. He said there is need to cut expenses drastically considering current revenue status. In Uttar Pradesh, COVID-19 hotspots in 15 districts have been sealed from midnight till April 15th morning. These districts include Meerut, Ghaziabad, Gautam Budh Nagar, Agra, Kanpur, Lucknow, Sitapur, Saharanpur, Varanasi, Shamli, Firozabad, Bulandshahr, Bareilly, Bassi and Maharajganj. The hotspot zones have been selected on the basis of 6 or more COVID-19 cases reported from the area. The state government has identified 22 hotspots within Agra, 13 hotspots in Ghaziabad, 12 hotspots in Lucknow, Noida and Kanpur each, 7 in Meerut, 4 hotspots have been identified in Varanasi, Saharanpur and Maharajganj each and 3 each in Shamli, Bulandshahr, Firozabad and Basti. The containment clusters in Gautam Budh Nagar, Noida includes Sector 27, Sector 28, Sector 41, Sector 44, Sector 37, Alpha 1, Greater Noida, among others.
The sealing of the hotspots in these 15 districts means that people in the sealed hotspots will not be allowed to step out of the house for anything. Essential commodities will be delivered at home. People can order groceries and medicines online, and the government will set up a centralized call center where people can call to place order for essential goods. Vegetable and fruit market and any other place, including banks and shops where the crowd can gather, has been sealed. Anyone trying to enter or exit the sealed area will be booked. Each and every house in the sealed zone will be sanitized. Apart from the hotspots in these 15 districts, the lockdown in the rest of the state will continue as per the earlier directives. Sushil Chandra Tiwari, AIR News, Lucknow.
In Madhya Pradesh, corona-infected patients were reported in many new districts, including Vidisha, Raisan and Betul. The number of affected people in the state has increased to 341 so far. The maximum number of 173 cases were reported in Indore and 94 in Bhopal. So far, 24 people have died in the state and 25 people have been discharged from hospitals. Meanwhile, Indian Railways Coach Rehabilitation Workshop Bhopal has developed a mobile doctor booth named Charak with zero contact checkup facility. A report.
The mobile doctor booth Charak will facilitate zero-contact checkups in light of the novel coronavirus outbreak as well as ensure the safety of the medical professionals and doctors. The system will allow doctors to examine patients without direct physical contact. To facilitate the doctor for zero-contact checkup, a glass screen with 2 openings and fixed gloves has been provided. There is also a facility to immediately sanitize these gloves after examining every patient. Interestingly, for the creation of Charak, a modular toilet unit is being used by the technocrats of workshop. Sanjeev Sharma, AIR News, Bhopal.
Nearly 50% of the total 590 COVID-19 patients found so far in Mumbai are from 4 administrative wards of the city's civic body. 241 containment zones have been created in the city where at least 1 or more positive or suspected cases of COVID-19 found. Restrictions have been put on the movement of people in these zones to avoid spread of the virus. 57 staff members including nurses were quarantined at 2 civic-run hospitals in Mumbai on Wednesday after a patient each tested positive there. The total number of confirmed cases for COVID-19 in Gujarat has reached 186 with 7 new cases reported yesterday. Principal Secretary in the Health Department Jayanti Ravi has said 143 patients are stable and 2 are on ventilators. Around 100 staffers, including doctors of one of the largest hospitals of Ahmedabad, were quarantined after a 40-year-old male patient tested positive for COVID-19. In Gujarat, the government will provide free ration to around 60 lakh above poverty line families which are not covered under the National Food Security Scheme. This decision was taken during a cabinet meeting held yesterday. A report from our correspondent.
Chief Minister Vijay Rupani said that each APL1 cardholder family will be eligible to get 10 kg wheat, 3 kg rice, 1 kg pulses and 1 kg sugar free of cost. Around 3 crore families will be benefited from the scheme. Mr. Rupani urged that only those families which are in crisis and need food grains should come forward to take the benefit of the scheme. Earlier, the state government also distributed free ration to around 65 lakhs families holding either priority ration cards or Antyodaya ration cards. Aparna Khun, AIR News, Ahmedabad.
In Karnataka, a government-appointed committee headed by cardiologist Dr. Devi Shetty has recommended to continue lockdown at all the hotspots in the state with high prevalence of COVID-19 positive cases. It has suggested that close observation of the pandemic should continue for next 6 months. It has recommended closure of schools and colleges till May end. It has also suggested that interstate flight and train services and AC buses must not operate now. Andhra Pradesh yesterday reported 19 more new COVID-19 cases. The total number of cases has risen to 348 in the state. The new cases were reported from Anantapur, Guntur, Prakasam and West Godavari districts. With 75 cases, Kurnool district has the highest number of cases. In Tamil Nadu, the number of COVID-19 cases went up to 738 after 48 people reported positive yesterday. 21 people have been discharged after being cured. A 74-year-old senior citizen has also been cured. The death toll has gone up to 8 with 1 more death in Vellore. Test results in 344 cases are awaited. More from our correspondent.
The Tamil Nadu Chief Minister Edappadi Palaniswamy has appealed to the corporate bodies and industrial houses to donate their corporate social responsibility funds for augmenting medical infrastructure in view of the COVID-19 situation. The state administration has issued orders to incur expenditures on personal protective equipment, ventilators, consumables for hospitals, isolation facilities, and providing rations to the destitute and migrant workers from the Chief Minister's Relief Fund. Meanwhile, the containment activities involving house-to-house screening in the state have been expanded to 34 of its 37 districts. Jai Singh, AIR News, Chennai.
The total number of COVID-19 cases has increased to 11 in Andaman and Nicobar Islands, with 1 more case appearing yesterday. The person returned to Port Blair from Chennai in the same flight on 24th March. She has been admitted to the isolated ward of GB Pant Hospital at Port Blair. 562 samples were sent for testing, out of which reports of 523 samples have been received till date, while 39 are pending. In view of an ongoing curfew due to the pandemic, the Himachal Pradesh state government is maintaining adequate stock of essential commodities to facilitate people in open market. Chief Minister Jairam Thakur directed the officials that appropriate steps should be taken to facilitate harvesting by farmers. More from our correspondent.
Chief Minister Jairam Thakur has been constantly in touch with Deputy Commissioners, Superintendents of Police and Chief Medical Officers of the state through video conferencing. He directed the officers to ensure buffer stock in Civil Supplies Corporation depots. Chief Minister said stern action would be taken against those who found involved in hoarding and profiteering. Meanwhile, the farmers in the state have been asked to follow social distancing and safety precautions during crop harvesting season. Horticulture Department has also been directed to ensure door-to-door village-wise supply of fertilizers, pesticides and other plant protection materials to the horticulturist. Sanjeev Sundarayal, AIR News, Shimla.
Good news is coming from Ladakh. 78% of the confirmed COVID-19 cases have been cured and discharged from the hospitals. Our Leh correspondent reports, out of 14 confirmed cases, 11 have now been cured till now. The remaining 3 patients are undergoing treatment and their health conditions are stated to be stable. A report.
Transmission of COVID-19 in Ladakh is under control as there is no new case reported for the last 1 week. On the other hand, 78% of the confirmed cases have been cured. Surveillance and monitoring are being strictly implemented. Village heads have also joined through community channels. Health workers are conducting household survey to ensure 100% surveillance and monitoring of the situation. With Ramesh Chandra, Jangchen Dolma, AR News, Ladakh.
The Divisional Commissioner Kashmir, Pandurang K. Pole, yesterday directed all the Deputy Commissioners, DCs of the Kashmir Valley to strengthen ground surveillance teams and track down all absconding travellers of other states and visitors from abroad on war footing. He asked them to track visitors in their respective districts and ensure proper screening and administrative quarantine. Scientists from the Savitribai Phule Pune University have been working on solutions to the coronavirus epidemic. Last month, Dr. Balchandra Pujari and Dr. Snehal Shekatkar of Centre for Modelling and Simulation CMS developed a mathematical model to predict the spread of the disease by investigating transport links between cities.
An important part of this work was to demonstrate how the transportation networks of railways, roadways and airways contribute to the spread of any epidemic. This work was well appreciated in the Indian scientific community, and as a result, the Indian scientists' response to COVID has given us the responsibility of mathematical modeling of spreading of corona and similar diseases. We have developed several realistic models to study the spread of coronavirus in India and effects of various interventions like lockdowns and quarantining. This is expected to help policymakers to decide which interventions should be implemented in a given situation. Perhaps even more importantly, these models will help us mitigate the spread of other epidemics in future.
Dr. Prabha S. Chandra, Professor of Psychiatry at the National Institute of Mental Health and Neurosciences, has pointed out ways in which one can deal with the fear stigma associated with COVID-19. She said there are 5 ways to deal with this in the wake of the virus outbreak.
The COVID-19 pandemic has affected all of us and causes a lot of fear and panic and of course stigma. What are the 5 ways in which we can reduce stigma? The first, use proper terminology. Use terms like affected by COVID or recovering from COVID rather than the terms victim. Number 2, make sure that you do not disclose information about people who are affected by the illness or who've been quarantined and be supportive to them. Number 3, avoid sharing rumors which are unauthentic information. Make sure you go to the Ministry of Health and Family Welfare or WHO website to have the proper information about the illness. Number 4, do not create panic and fear. Do not use words like the world is going to end, all of us are going to die. Instead, share positive stories of people who are recovered and people who are helping each other. And finally, a plea to decrease stigma is to make sure that you enable health workers, sanitary workers and the police to work respectfully. Now, an overview of today's newspapers covering COVID-19 stories. Laying emphasis on social distancing being the need of the hour, all newspapers talk about the possibility of taking the lockdown further. The Times of India on its front page states, lockdown extension likely as PM talks of national emergency. Most newspapers also carry story on the importance of wearing masks, while the Hindustan Times says masks must in Delhi. The Times of India headline reads, you can't step out without mask in the city. Quoting the Maharashtra Chief Minister, Statesman headline reads, People should wear masks while stepping out of homes, Maha CM.
And now, before we end the special news program on COVID-19, the headlines once again. Prime Minister Narendra Modi interacts with the political party leaders, says priority is to save each and every life. US President Donald Trump thanks Prime Minister Narendra Modi for allowing export of hydroxychloroquine, says India's gesture will not be forgotten. First installment of relief package to 20 crore women Jan Dhan account holders released. Supreme Court directs COVID-19 tests in approved labs to be conducted free of cost, and 20 COVID-19 hotspots sealed in Delhi to tackle the spread of the virus. Uttar Pradesh government also seals hotspots in 15 districts. And with that, we end the special news program on COVID-19.